It's Delegate Destiny Levere Bolling's first session in the Virginia General Assembly representing the 80th District. She says she knows her elected position gives her a platform, and although she's passionate about many issues, one particular topic hits home: the high maternal and infant mortality rate in the Black community.
Talking about real lives who just want to grow their family and are dying because they want to grow their family.
It's a topic she has experienced firsthand.
So that's his little handprint, and it's so cute. I think so, anyway.
She lost her son Noah last year.
Actually having labor contractions and like labor pains and didn't know. Like I was going to events. This was during campaign season.
Bolling says she had difficulty getting in contact with her OBGYN's office.
Just unbearable, but it got to the point where I went to the bathroom and my water broke. I felt constipated, but my water actually broke and had to be rushed to the hospital.
Noah was born at 19 weeks old and was stillborn.
I'm Noah Gabriel Bolling. He was born on August 26th at 11 p.m. exactly. Slid on out.
Although her time with him was brief, she says she still remembers all the little things about him.
He had in his little hat, which he couldn't even really fit in this diaper. It was a little big on him. But it was cute. It was cute.
According to the March of Dimes, in 2019 to 2021, the Black infant mortality rate in Virginia was the highest amongst Black women compared to other ethnicities. And the maternal mortality rate is also just as disturbingly high. Nationwide, Black women are up to 3 times as more likely to die during childbirth. However, that number can be higher or lower depending on where you're from.
For some patients, that in some areas, in really rural places, that can be as high as 6 times their counterparts. So really having some appreciation for having access to care and having access to good care so that we are not dismissing the fact that some women are really at risk.
I sat down with Dr. Tashima Lambert-Giles and asked what are some of the causes.
So when we talk about the actual reasons for maternal death, we talk about hypertensive disorders, from a Black maternal death standpoint, but then we also talk about things like hemorrhage and we talk about things like sepsis.
Could these deaths be preventable?
Oh man, the CDC did a study on that and said 80% of our maternal deaths are preventable. 80%, that is a huge number. And that is exactly why this is a big deal and why we're talking about this in the first place. Because if 80% of the deaths that we are seeing are preventable deaths, that means that there is a lot that we can do for this process.
There are doctors who believe Black women have a higher pain tolerance than any other racial group, which isn't true. This is something that doula and founder of Birth in Color RVA, Kenda Sutton L., says has been ingrained in history.
Black people have never been treated fairly in the healthcare system. So a system that hasn't been designed for us, that was never really to help us or to help us become healthy, we're still in that same system.
According to advocates, in order to counter this belief, studies have been conducted showing that many Black women's concerns are not being heard by medical providers. This type of action is deadly, which is why Sutton L. says it's important for Black families to have advocates on their side through the entire pregnancy.
It's extremely important, right? So you have someone in the room that looks just like you, so you don't feel threatened or anything. You have someone who's educating you and your partner. We don't take the place of our partner, we empower both.
Pregnancy can be a happy but stressful time for many women, but Dr. Lambert-Giles says Black women face an extra hurdle.
The Black community is already oppressed in so many other ways that before pregnancy, they are just having so much that's coming onto this plate. I think that trauma outside of pregnancy kind of just adds to that, right?
I know the stories. I know the truth. I know that women that look like me and other women, we're not just numbers. It's not just words, black and white on a paper. Real lives. And we can change and affect real lives every day.
Bolling says with her position at the state legislature, she's hoping to affect change.
So I'm prepared to fight, and it's not an issue that I'm going to give up on. It's not an issue that one piece of legislation is going to fix. There's a lot of systemic things that we have to dig into, and maybe Virginia's we might not be the place to solve all of the systemic issues, but we're for sure the place to start.
Reporting for VCU InSight and the newsroom at VCU News, I'm Nia McMillan.